We don't have a healthcare system in the U.S. We have wonderful people, wonderful parts, great institutions, but we've never put it together as a system. And he said on top of that, we have, of course, the dollar has become the prime motivator in every different way. Until we finally understand that it's not a question of this ism or that ism, it's a question of how do we get doctors and nurses and hospitals back to doing what they are there to do, which is take care of patients the best way medically they know how. The role of health informatics, in fact, becomes a central element and one that we need a lot more of, and here's why. We have no systemic methodology of sharing best practices worldwide. We have a very clunky system. It involves some wonderful journals and some incredible people working their hearts out, but we need to be able to do what we do in aviation so well. If we find out that a Boeing 737 has a systemic problem on Monday morning at 9 a.m. Central, by 10 a.m. Central, the entirety of the central structure, Federal Aviation Administration, Boeing, etc., are going to know about it. By that evening, there's going to be a fix out there, and everybody's going to know about it. In healthcare, it may take years before a particular best practice filters down to everybody else. It's human nature for some people to be more comfortable following than challenging. But the problem is that in medicine, every member of the team, no matter whether they think they're important or not, they are important. Even somebody down in central processing is extremely important. That team has got to be able to communicate seamlessly. Informatics is absolutely critical in this, but we've got a whole other mountain to climb.